The South African Human Rights Commission is continuing its mission to investigate public health in Gauteng. Today, the Commission is visiting the Hani Baragwanath Hospital in Soweto. Last week, a fire broke out at that hospital's laundry area. Our reporter, Nqobile Madlala, is following that story, and she joins us now live with more details. Nqobile, I see you're still walking around the facility. What is it exactly that the Human Rights Commission has found or at least heard from either patients or nurses there?
Well, at this point, Maseko, like you're saying, it is still a walkabout. But what they're saying is they want to look at those issues that have been highlighted. We now know from the CEO that there are infrastructure issues that have affected the way that they work. But of course, to give us more details, we have the South African Human Rights Commission spokesperson here, Boang Jones. And I'd like to find out, Boang Jones, today, what exactly are you hoping to find, especially in this long walkabout that you're currently doing?
Well, our visit here seeks to examine the physical infrastructure, to test the correctness of reports that there are maintenance issues, equipment failures, and shortage of linen. And this morning we had a constructive interaction with the CEO of the hospital and the Department of Infrastructure Development in Gauteng. And we have agreed that they will provide the Commission with formal responses next week. They did provide some context to some of these challenges that have beset the hospital, and most of which are not of their own making. And that is why the Commission has determined that there should be a broader engagement with the heads of Department of Infrastructure, Health and Provincial Treasury. And the meeting will take place in the first half of July in order for us to unpack the issues and to find lasting solutions.
Let's talk about those issues. Which ones are the ones that would be immediate, perhaps, to ensure that the hospital is in good running?
I think the main one is infrastructure. There are serious challenges when it comes to infrastructure. The hospital is old. They're still using old infrastructure. There's a need to refurbish, to replace infrastructure, and that is where we're going to focus our attention, so that there is sufficient infrastructure to support hospital employees and professionals to do their work.
I mean, it is worrying, though, that 870 people were not attended to.
It is worrying, but this is out of how many? The hospital has done 24,000 surgical procedures, and just 870 could not be attended to for a myriad of reasons. And the hospital will give us a breakdown, and some of them have been rebooked, and we were satisfied with the response from the hospital.
All right. And also we understand that this is one of many walks that you are going to be looking into. You went to Rahima Musa as well. Would you like to give us an update in terms of what happens in that hospital now?
Well, Rahima Hospital, we are still in discussions with the hospital. The DDG for Hospital Services in the province and the CEO of the hospital, they have requested a follow-up visit. We are hoping the visit will be on Wednesday or Friday this week, if the management at the hospital is still keen. But the Commission has requested the hospital to provide the Commission with periodic reports, because we have to monitor the implementation of the outcomes of the last meeting we had with the hospital. But we will also seek further clarity regarding the situation of Dr. Tim de Meyer, because we are of the view that we should not silence those who speak out. They should instead be encouraged and be supported, because they also have solutions.
And let's talk about people who are speaking out. Today we were speaking to a mother who is alleging that Telemogorane has, in a way, not found the child that passed away when she gave birth. This is something obviously the family is battling with, and they're very traumatized at this point. Is South African Human Rights Commission going to be looking into anything into that?
Well, we'll have to get more details, but as an intermediary institution located between citizens on the one hand and government on the other hand, we stand ready to provide support, and we will advise the family. We will have to establish what has happened. Is it due to negligence on the part of the hospital, or there are other reasons. So we will request all the details so that we are able to assist the family, and we sympathize with the situation, and we hope that the hospital authorities will also cooperate when we seek more information on this.
All right. Thank you, Boang Jones. I want to bring in the CEO here because she was the one highlighting everything. Mama, please just introduce yourself to obviously the viewers as well, as we want to find out 870 people have not been seen. What is the hospital going to do about this?
My name is Dr. Nqobile Madlala, and I'm the CEO at Chris Hani Baragwanath Academic Hospital. The 870 people that were deferred, some of them have been rebooked, especially those that were deferred because of patient-related factors. The attending clinician will then have to optimize the patient and rebook as and when the patient is ready. So the others, of course, because these are elective procedures, they are not emergency procedures, we will rebook them. But at the moment, I cannot tell you how many of the 870 have been rebooked, because over that 4-month period, we have done over 24,000 surgical procedures in our 43 theaters across the hospital. And if you do the ratio analysis, there is about 3.5, less than 5%, it's usually 3.5% of the patients that were cancelled. So a lot of work is done at this hospital. And of course, it's not ideal to cancel any patient for whatever reason. But as hospital management, we are not in control of patient-related reason for cancellation. That is, the clinicians are in control and they will be rebooked. We're just concerned about the infrastructure challenges that then impact negatively and does not create an enable environment so that the health professionals can do their job.
If you can just give us an idea, what are those infrastructure problems, and do you feel that the South African Human Rights Commission being here means that you are going to get the assistance that you need?
We certainly hope that they will assist us to resolve, because these problems are long-standing, they are not new. In terms of equipment, really, it's not about medical equipment that we are responsible for as hospital management. We've got enough equipment, we service our equipment. These are infrastructure-related equipment. For example, the tunnel washers in the laundry and the boilers. Department of Infrastructure and Development is the implementing agent. They need to service us. They need to make sure that all these infrastructure-related issues are not a hindrance to delivery of quality healthcare services. Yes, we are hopeful that the presence of the commissioner here will assist us to, because to raise up the level of awareness with the people in control, so that we can be assisted, because some things are certainly outside our span of control.
All right. Thank you, CEO. Nqobile Madlala, who is the CEO of Baragwanath, Chris Baragwanath Hospital, as well as South African Human Rights Commission, Boang Jones, speaking to us there, Masego, about the issues that the hospital is facing. But they're saying that even though there's 870 people, and I think you and I would agree that that's a lot of people, but they're saying that in comparison to the number of people that have gotten service, it's a smaller percentage, but it's one that they're willing to look into, and also make sure that the South African Human Rights Commission, as they do a walkabout, that they look into that matter and hopefully it can be fixed.
All right, Nqobile Madlala, let's leave it there for now.